Of course, our pets, just like us, age, and that aging can lead to a variety of behavioral problems. Dr. Melissa Webster from the Tampa Vet Hospital is back with us now with ways to care for our older pets, because they actually do need a whole different type of care, don't they?
Yes, yes. The more mature.
Good to see you, by the way.
Good to thank you for having me.
Yeah, of course. So, you know, it's very interesting to note that a senior dog is really different from breed to breed or mixed breed to mixed breed, isn't it?
Right.
So,
yes.
So, for instance, like a dog like this is a mix, and what would be old?
Oh no, that is a purebred dachshund.
Oh, this is.
Yeah, she's 12, and that's Molly Longoria. She's very famous.
Yes, we should really point out there was a famous dog in our midst. This is Evan Longoria and his fiance's dog, which is so cool to have, and you treat them.
Yes, and very blessed to be able to care for them.
Yeah, that's very cool. And the dog knows how to play baseball.
I think very well.
Yeah.
Yes, from at least genetics from Dad.
All right, now how old is Molly?
Molly's 12, so chronologically she's a mature senior pet.
Yes.
And behaviorally we watch them that they don't start sleeping more, drinking more, and having urinary accidents or getting caught like in corners. Sometimes dogs will come in the house and they'll be walking around a room and just get stuck in a corner.
Right. I have a senior dog at home as well, Jake.
Yeah.
And he has presented, or there are many issues that he has, and tumors that have come up, and operations that have had to have, and the list goes on and on. We need, like,
I'm sorry.
Oh no, but he's being well cared for, and he's doing very well. He's got 29 lives. So let's talk about the type of care that's needed specifically for senior dogs.
Yeah, senior dogs, we want to, as veterinarians, we want to do a full physical exam from the tip of their nose to the tip of their tail, ideally twice a year. If they have cardiac issues, we'll probably want to see them every 3 months.
Really?
Just like a person, because we want to check their blood pressure, see what their mental status is, make sure their organ function's okay. Because they can look great on the outside, but possibly have kidney or liver problems. Or get anemia. I was seeing a pet this morning. He looks on the outside perfect, but his red cell count's very low.
Sure.
You wouldn't know without taking some blood. And then we do screening x-rays of the chest and abdomen to make sure things are normal too.
The dogs, like my dog, typically is deaf and is blind as a result of age. He's 15 and a half.
Oh, that's awesome.
I know, but he still eats. He's still, but he loses, you know, his balance because he falls a lot. You know, he's got weak joints. But you know, I'm doing everything I can to keep him going. He doesn't exhibit any kind of crazy behavioral problems, though, as well. What kind of behavioral problems are you seeing?
Well, sometimes they can be vocalizing and start crying or
Does that
whining.
mean they're in pain?
It depends. You have to kind of couple it with what's going on and talk with your veterinarian and video them, please, with your cell phone.
Right.
That helps us so much.
Oh, that's a great idea.
Because I can see a lot of behaviors that they don't exhibit when they get the vet office because they're fine, you know, which is so frustrating.
Isn't that always the case?
Yeah, right.
Yeah.
But some of the other behavioral problems are you come in the door, the pet's not getting up. They, you know, may have, like you're saying with Jake, lost the hearing.
Yes.
And it's a hard one for us to detect in the office because they have so many other senses.
Sure. You should also consider the food that they're eating, right?
Yes, diet's super important and nutrition's very important. The senior patient, we may want to change the protein amount or the fat or the actual fiber to make sure they're going to the bathroom properly.
Yeah. Well, fantastic information, Dr. Webster. Now, I got to tell you, Molly, you got to tell your dad to keep that team going strong, okay?
Yes.
Go Rays.
Go Rays.
Okay. Thank you, Dr. Melissa Webster. Always a pleasure to have you. We'll be right back with more Daytime right after this. Go Rays!